Hi everyone. I cannot see you, but I hope that you can see me and hear me all right. My name is Adrien Auger. I'm the Chief Operating Officer of the CyberPeace Institute, a nonprofit based in Geneva. And I have the honor of presenting to you today one of our projects called Cyber for Healthcare. So let me pull up the presentation that we have prepared. I'm not sure that you can actually see it, so reload it again. There we are. So Cyber for Healthcare, as I was mentioning, is one of our initiatives, which aims, as the name suggests, at bringing cybersecurity to the healthcare sector, which is at threat lately. There's been quite a significant increase in cyber attacks against the healthcare sector over the last few months, in particular since COVID-19 started. And there's been a ransomware attack in Czech Republic. I think it was back in March already. It was a strong signal that sent shockwave through the entire sector, and was an announcement of worse attacks to come. Other attacks happened more recently. One in particular in Düsseldorf, which was connected to, unfortunately, the passing of a woman. The prosecutors are still investigating the case, and the latest information we have is that actually the woman would have died anyway. But basically the ransomware attack in the hospital forced medical staff to relocate some of the patients, and that particular patient died on the way to another hospital. There's been also a more recent attack even against the UHS, which is a chain of hospitals in the United States. With over 350 hospitals in the US that crippled really their entire systems for over 3 weeks, meaning that a lot of the medical staff had to go back to pen and paper, which, as you can imagine, had a non-negligible impact on patients there, whether COVID and others. Obviously, because of the pandemic, it creates an extra hassle. Staff is already tired because of the pandemic, managing the inflow of patients when you don't have IT systems, managing those that are sick of COVID and those that are not, making sure that there's no extra contamination is an extra burden when systems are down. So it's a worrying situation. The CyberPeace Institute has been involved in the fight against cyber attacks in the healthcare sector for a while now. We have issued a few months ago a call for governments that was signed by a lot of Nobel Prize winners and a lot of leaders of international organizations like ICRC, for instance, and others. Asking for these attacks to stop. And we have also taken the matter into hand and launched ourselves an initiative to bring cybersecurity to healthcare organizations. And so this is what I'm privileged to talk about today, Cyber for Healthcare, which connects top cybersecurity companies in the world with healthcare organizations in the fight against COVID-19 to provide them with free cybersecurity assistance right now. So you can see it as temporary pro bono cybersecurity offered by reputable companies. And the Institute sits in the middle and provides the matchmaking, protecting the anonymity of healthcare organizations that are interested in securing the systems and not falling prey of cyber attacks like those that I just talked about. In practice, it's fairly simple as an idea and as a service. In practice, we have a website. Organizations that are interested can simply go on the website, give us their contact details, and we'll rapidly call them and assess what is their need. And then based on that, we will propose to them one or more of the partners of Cyber for Healthcare, telling them what they can do basically for them. And once they agree with that, then we make a connection, we make a match, a little bit like a dating app, if you want. And then we follow that relationship through to the end. So the idea is to provide a variety of cybersecurity services, from a first-level cybersecurity audit to evaluate weak spots, for instance, all the way to a penetration test of a website, or network hardening, or a specific ransomware mitigation services. Some of our partners offer also anti-phishing training, for instance, which is a big concern. Some of the victims that we have talked to, now that a lot of their staff is operating remotely, we've had to launch a lot of new policies and procedures and install a lot of new systems that they didn't have before the pandemic. And so it's leading to heightened threats and concerns. In particular, in the healthcare environment, where lots of the organizations we work with are concerned about privacy and clinical data. So all of this to say that cyber healthcare is really a customizable service, in the sense that our partners are flexible in terms of what they propose. They're really interested in helping now during the pandemic, and then put on the side a little bit financial considerations. Let me follow on. So what is the CyberPeace Institute, you may ask, right? I realize that we're not yet a world-famous organization, hopefully soon. We were set up about a year ago. We are based on private funding coming from Microsoft, from Hewlett Foundation, from MasterCard, Facebook, and a few others. And we are based in Geneva. We're a non-profit. And our mission is to bring about stability to cyberspace, as the name captures, to bring about cyberpeace. And we actually have a quite interesting way to do that, right? Our theory of change is that to bring about peace in cyberspace, we need more accountability. At the moment, one of the main obstacles to peace in cyberspace is the lack of accountability. It's the fact that anyone can do anything and get away with it. And we want to change that. So the way in which we want to change that is to work with organizations on the ground in healthcare, but also in other verticals, right? Be it water scarcity, for instance, or food, or energy, or other critical civilian infrastructure sectors where we find vulnerable populations should these sectors be attacked, and work with them to secure them, but also to understand what is happening and to gather hard evidence on the real-life impacts of cyber attacks on the ground. We analyze these attacks thanks to a huge team of cybersecurity investigators, forensic investigators, and really well-skilled professionals in cybersecurity that are able to deconstruct those attacks following an almost a scientific process, right? With a review process with other parties outside the CyberPeace Institute coming and looking at that evidence and corroborating the conclusions that we draw, and then use those conclusions that are rooted in hard evidence collected on the ground to push for a better narrative at international level, to push for better international norms, to go back at the Paris Peace Forum, for instance, to go back at the UN, to go back at other international forums like the Open-Ended Working Group of the UN, and push for better international norms in the hope that there will be a magic loop, and that by using that evidence from the ground all the way to decision makers, we can have a virtuous cycle that will then impact positively back the populations that are vulnerable in the first place. So that's the CyberPeace Institute. One of the first projects is obviously cyber healthcare, but there are others. Moving on. The partners that we select obviously follow a strict selection procedure. So we don't partner with everyone. We make sure that the organizations that we work with are not only skilled and reputable, but also share the same values when it comes to making a difference in cyberspace. And we are also super careful, as I was mentioning earlier, of the privacy and the data protection aspects that are inherent to some of the things that we end up learning through our activities. Because that's our bread and butter. Cybersecurity is basically our career, our life. We do that every day. And so we're very conscious about the risks of having information leak in terms of the vulnerable populations that are working with us. Those are the partners that we're currently working with. So Bizone is a cybersecurity company based out of Moscow in Russia. Was set up by Sberbank, and he's an amazingly skilled technical partner in the region. CyberReady is a partner from Israel that has quite a simple way to raise awareness on cybersecurity. It's very powerful. Cybersecurity is based out of Estonia, out of Tallinn, and quite experienced with exercises and trainings as well. The Global Cyber Alliance, of course, Microsoft, you may have heard of, Rapid7, Unisys, US Medical IT, as the name indicates, based in the US. And we're also working with a couple of other partners that are providing more support than actual help in kind, which is the network of certs, so FIRST, Sec3R, Cycline Security, and the Global Forum Cyber Expertise. Voila. So we have a website, as the name indicates, cyberforhealthcare.org. You can obviously find us also on cyberpeaceinstitute.org. Get help directly from the website using either the form that we have, chatbot. And that's pretty much it when it comes to cyber for healthcare. Just sharing a couple of results so you understand where we stand. So we organized already a couple of labs, which are basically live events on the topic of cybersecurity in healthcare and corporate volunteering that you can find on YouTube and on our website. We have onboarded a number of volunteers, so 5, that have helped us contact almost 1,000 organizations that may need help. We've launched a number of videos and other ads on Facebook and other social media and reached over 1 million people thanks to that channel. We've received and processed over now 100, now we should be at about 120 requests for assistance, but a lot of these are rather either inconclusive, either we can offer the help fairly fast, and those are not really what we consider like actual cases. But we've received and processed 6 now actually legitimate requests of organizations that we're actively working with and providing support throughout the past few months. What we found is that a lot of these requests come from NGOs, some from social entrepreneurs, but that have limited resources. That's fairly natural conclusion, but it's good to have it field tested, let's say, in the sense that obviously larger healthcare organizations tend to have enough resources to contract professional paid cybersecurity help. Also, they may be ashamed of getting free cybersecurity help, although there's no shame in that at the moment. And a lot of our partners offer, all of our partners offer very professional services. We also find that it is obviously a sensitive service to provide. We're fairly aware of this. And so it can be difficult to break the initial trust obstacles with organizations on the ground and make them understand that we are not there to compromise them, that we are not a scam, that we are a legitimate partner. And so that has to do also with our brand identity, with our reputation. And this is something that's going to get better over time. But obviously, if the CyberPeace Institute tends to be fairly known now in cybersecurity circles, no one knows the CyberPeace Institute in healthcare or in water or energy sectors, right? So there's this barrier that we need to go through at the beginning, but that it will get easier over the years. And we find that using word of mouth, using partners on the ground, people that have worked with us on the ground is super helpful in breaking that initial trust barrier. And so word of mouth and referrals are some of the things that we're currently building or improving, let's say, to make sure that those who need help actually knock on our door. When it comes to next step, the Institute will obviously continue its outreach and engagement, trying to make the initiative known. And what I'm doing right now is part of that strategy. We are obviously debriefing the partners that we have worked with to try and understand how we can improve our services, what was useful, what was not. We are looking at providing long-term support as well. So it's not that somebody, it's not a in and out initiative, right? It's not that we provide assistance and then we don't engage anymore with those that we've helped. No, we try and develop a long-term relationship. We provide them with awareness raising trainings. We make sure that their staff gets access to resources so that they can also protect themselves. So we try and do a bit of capacity building, essentially. As I was mentioning, we try and incentivize word of mouth, so through referrals, through video testimonials and things like this, so that others hear from some of the organizations that we've helped already. And we are looking at building a more sustainable model beyond the end of the year, for the mere fact that our partners are commercial partners, and their objective at the end of the day still is to turn in a profit. And so it is not necessarily viable for them to remain partners forever. So hopefully as well, the pandemic will draw to an end next year. And so we're looking at seeing how we can develop a model that could be used in other verticals as well. So there's actually more that we will announce at our anniversary at the end of the month when it comes to a network of volunteers that we will be able to deploy across the globe. And I think that's mainly it. Yeah. So Dimitri, who's helping me with the questions. Thank you very much again. I'm super available for any question there may be. Okay, so thanks everyone for your attention. There's a first question. If a particular healthcare institution wants to partner with CyberPeace Institute, what steps should it undertake? Super simple. Either you go on cyberhealthcare.org, fill the quick form, which just like give us your name, your organization, and we'll contact you. Or directly go on the cyberpeaceinstitute.org website, and there you can ask for assistance directly and get on our mailbox, and we'll get back to you in no time. So that's super easy. And perhaps one thing I didn't make clear at the beginning is that cyber healthcare is really open to any organization in the world. So there's no geographic limitation, there's no status limitation. So if it's a government organization, if you're a private organization, if you're an NGO, you can knock at our door and we'll help, right? Obviously, if you're the head of a multinational chain that has lots of cybersecurity contracts all over the place, well, we may not be the best partner. You may find help through the contracts that you already got, but if we identify together that there's something that we can do, we're more than happy to support. Some of the NGOs that we work with, have over hundreds of staff around the world, and they just haven't considered yet cybersecurity as a big threat. And now that the pandemic is all over the place, now they're seeing that WHO was attacked, that hospitals are falling because of ransomware attacks. They start to get worried and they're like, well, where do we start? So we're a good partner to do that. So don't hesitate, really. Okay, who are the primary targets of these attacks? So, okay, first there's a variety of attacks, right? Talking about, I've talked a lot about ransomware attacks because this is the main trend that we're seeing, but there are other attacks. Now, ransomware attacks are interesting or sad in the sense that I'm not sure if you guys are familiar with how they work, but basically they take hostage IT systems, computers, right? They encrypt part of the hard disk, making some of your files inaccessible, or some of your systems inoperable. And attackers ask for money. They ask for ransom to be paid in order to unlock your system to give you access back to your files. And the pandemic obviously puts a lot of stress on hospitals and a lot of, let's say, value to hospitals, and that value translates into financial value. So some attackers are basically attacking hospitals in rich countries because they think that they will have enough money to pay. And so that's why, for instance, I think it was 2 weeks ago, the Cybersecurity Agency in the US issued a note that there was a super high threat against hospitals of ransomware attacks. And as I was mentioning, UHS fell victim of that, and others fell victim of that. This is not necessarily a new trend. We've seen attacks like these in 2017 with WannaCry and the NHS in the UK that was massively hit by ransomware as well. But I think it's perhaps one of the first time that we have such a momentum around attacking healthcare infrastructure, and that's just because of the pandemic. When you have the Olympics, then attackers switch to the new topic, which is the Olympics. When you have the FIFA World Cup, then it's football. They try and change tactics. Some groups actually, groups that operate as ransomwares, it's very professional people, have hotlines and everything, have actually declared that they would not attack healthcare infrastructure anymore to protect human lives. And but unfortunately, some other groups are not as, let's say, compassionate, if we can talk about compassionate and cyber criminals, and have continued their attacks. What are the current international standards for sanctioning cyber attacks? Is it enough? So that's a good question. It's a good question. I'm certainly not the best person to answer. I'll give it a shot. But my understanding is that the international standards that we have are not enough. There's a lot of fragmentation. There's a lack of international cooperation. There's a tremendous difficulty as well to attribute cyber attacks. Attribution means to simply to determine who's behind an attack. If you're not familiar with computer systems, it's fairly simple these days to hide between layers of technology and basically prevent police forces from either identifying where you are or from simply prosecuting you because you appear to be in a region or a country where it's just very difficult to cooperate internationally. So the Institute is working on improving those standards, and our approach to doing that is to bring hard evidence to decision makers so that they can really have informed discussions that are not politicized. Today, unfortunately, cybersecurity and attribution are used to support political and military narratives that sometimes are not always rooted in hard evidence. So the approach of the Institute is to bring that evidence with a transparent process so that everyone can see what is happening and what is not happening, and to allow decision makers to take the right decisions, to allow for international lawyers to push for better standards, etc. By the way, our theory of change around accountability goes far beyond attribution, right? We're also looking at positive change, positive reinforcement. We're looking at all those initiatives that are good in cyberspace, that are not just about those that are not upholding their responsibilities, but those that are, because we also believe in positive reinforcement, right? So it's not just about the bad guys, it's also about the good ones. Good question though, thank you. And for more information, don't hesitate to go back to us. Actually, I think we're publishing at the end of the month a paper at Indiana University exactly on that question. So it's a topic that some of my colleagues are far more experienced at and would speak in better terms than I do. But it's definitely like the key topic for us. Next question is, what are the main states behind the cyber attacks and who benefits from them? So first of all, a lot of these groups that are conducting ransomware attacks are not necessarily state-sponsored attacks. A lot of them are after financial gain, and so they may actually be spread in various geographies and not necessarily attached to a particular country. So their interest is making money. It's a very lucrative business, and they just do that. The way in which we can change that is, my limited understanding is that if we understand a little bit better their dynamics, and we try and increase the costs for them and increase the risks of getting caught and going to jail and things like that, potentially we can also change this dynamic. We don't look at it just from the let's say the persecuting part, but also from the lack of opportunity, right? A lot of people unfortunately choose the dark side because of a lack of better opportunities. So at the CyberPeace Institute, capacity building is also something important for us in trying to develop local ecosystems so that there are opportunities for everyone to use their skills other than conducting ransomware attacks. And then when it comes to states, really like, some states are obviously more active than others. Some are more, have a more, let's say, militarized approach to cybersecurity than others. But I don't think that it brings any value to point the finger at one or the other. Like, offensive security has always been part of military strategies in pretty much every country, and we're not here to say that this is going to change. We're not here to say it's good either. But I personally, I don't think that there's really like any state that is particularly more active than others. I think that all states are. Some are certainly more active when it comes to criticizing things openly, and this helps to inform a public debate and shape a culture around cybersecurity that brings about more change. But at the end of the day, pretty much every state is involved in cybersecurity, whether it's offensive or defensive. It is a reality. So how do we collaborate with national institutions? That's a very good question. So the Institute tries to be completely neutral, independent, and so the work we do tends to stay away from government relations. So we don't take money from governments. We end up interacting with governments because states play a major, if not the most important role in shaping cyberspace and in particular cyberpeace. And so we talk to a lot of governments and we try and make them uphold their responsibilities. We try and make them take more responsibilities when it comes to protecting their vulnerable populations. But we have a very distant relationship in the sense that we try and protect our neutrality. So the Institute really works with and for everyone. But good question, thank you. Oh, let me go down. How do you explain the development of cyber attacks against health facilities in recent years? So based on the research that we're doing, I wouldn't necessarily say that there's an increase in cyber attacks in recent years. Definitely there is in recent months, and that's simply a societal phenomenon. As I was explaining earlier, attackers are after whatever will make people click. And if I send you an email today that tells you that I have a mask that you don't need to wash ever, and it's going to protect you of everything, chances are a few people will click, right? Now, next year, if we have, or what is it, in 2 years, we have the World Cup in Qatar. If I send you a picture of Ronaldo that invites you gives you a ticket or whatever, a few people will click. So a lot of the attacks that we're seeing in the last few months are simply for the fact that attackers are after whatever will make people click, right? Phishing emails, those emails that look legitimate but actually are not, are still the main infection vectors nowadays. And a lot of ransomware attacks are actually starting by somebody clicking on the wrong email. So that's my take on it. I wouldn't think that if there was no COVID, I don't think that we would see that surge in attacks against healthcare facilities. Do you think the development of new technology creates new risks for cybersecurity of healthcare? So yeah, absolutely. New technologies always bring about opportunities and risks, right? Think of nuclear energy, for instance, right? When nuclear energy was invented, I don't think that Einstein had in mind that it would lead to atomic bomb, yet it did. So all technologies have a dual use. Oh, 30 seconds, sorry, I have to rush. So yes, the answer is yes, all technologies present opportunities and risks. And it's a matter of us in the cybersecurity industry to make sure that the opportunities outweigh the risks. But great question, and we can talk more about it. Send us an email, visit our website, and we can discuss this more. Thank you very much, everyone, for your attention. Great questions. Thank you.